Hi, I'm Beth Vitolo, one of the patient care supervisors here at Centera Martha Jefferson Hospital. Welcome. They asked me what advice I would have for a new nurse. Well, I have a few pieces of advice. The first one, be patient with yourself. You're not expected to be perfect, and everyone started where you are now. Everyone. Accept mistakes. Mistakes will happen. Any nurse that tells you they've never made a mistake is lying. We're all human, and mistakes will happen. We use them as a learning opportunity. Be honest about them. Report them. We figure out what happened, what we can do to prevent it from happening again in the future. We use it to prevent it from happening to someone else. A learning opportunity. Listen to your patients. No matter how much you think that you know about their disease process or condition, your patient knows their body better than we ever could. Pay attention to what they're telling you. They may be describing a very important symptom. Keep calm and carry on. When a situation escalates, it's important to remain as calm as possible so that you can be helpful and make appropriate decisions in that moment. As a nurse, you will have some unbelievable conversations with your patients and their families. Wear your poker face. Never show any judgment. They're trusting you with things that they would never share with anyone else. Don't let them down. Never be afraid to ask a question. Remember that nursing school gives you the basics, and as a nurse, you are now a lifelong learner. Always know where to find your hospital policies and procedures, or know who to go to help you find that information. You're not expected to know the answer to every question, but we do expect you to know where to go to find the answer. Remember to take care of yourself. Hydrate, drink. By the time you are thirsty, you're already dehydrated. Find time to take a break and use the bathroom. Eat and sleep well. You need to take care of yourself in order to take care of others. Find that work-life balance. Time management is a skill that you will develop as you progress through your first year. You will learn how to prioritize patient care based on their acuity, and you will become an expert at adaptability and organization. Just give yourself the time to develop those skills. You can now cheat. Yes, I said cheat. You're no longer in school, so I encourage you to cheat to learn. No longer have to memorize things like you did for school, but know where to look things up. Look up all your medications before you give them. Refresh yourself on procedures before you perform them. Look up the lab values and appropriate vital signs. So cheat to learn. Communication is paramount, above all else. Get to know your team members. Introduce yourself. This helps them to put a face with the name. It will help when you're speaking with them on the phone later. Don't be afraid to call or page the physicians, but do have all the information in front of you. And remember, the physician that you're speaking with may not know the patient. They may just be the physician on call. Use SBAR. SBAR is a communication technique which helps to improve the effectiveness of communication among the healthcare team. SBAR stands for Situation, Background, Assessment, and Recommendation. Give the situation. Clearly and briefly describe the situation at hand. Background. Clear and relevant background information. Assessment. Your professional conclusion. And recommendation. What do you need from this person that you're communicating with? Good nurse and physician communication is critical. It helps to reduce errors and contributes to a good outcome. Ask questions about the orders. If you don't understand them, ask for clarification. Remember to treat everyone with the same respect that you would like to be shown. If a conversation is escalating, voices are getting louder, it's important to recognize that the communication has broken down. It's no longer productive. When I'm faced with this situation, I simply say, I believe this conversation is no longer productive. When we both calm down and can have a more productive conversation, I will be happy to continue our discussion. If you deal with an unprofessional coworker, please look for support. Seek someone and tell them of the situation. Report it to someone higher in the line of communication, a charge nurse or your manager. It's never okay to be personally attacked at work. And finally, enjoy it. Congratulations. You've worked hard for this moment. As you transition into your role, enjoy those steady paychecks, the paid vacations, making friends at work. You've worked hard and you deserve it, so enjoy the moment. Welcome to Centera Martha Jefferson.